You're watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Today's topic, don't let your fear of the dentist keep you from having the smile you've always wanted. Or you may have the excuse that you're too busy to get over to the dentist and have the smile you've always wanted. Well, according to my first guest, who's an expert on the topic, Dr. Hedgecock, says with IV sedation, you go in, you go out, you don't even remember the procedure. Dr. Hedgecock, welcome to the program.
Thank you for having me.
Is that right? I mean, some people don't even remember the procedure with
complete
sedation?
complete amnesia. People don't even remember hardly coming to the office.
So before we get into today's topic, tell me a little bit about your practice. What are the different procedures that you do?
Thanks. We do a lot of different procedures in our practice. Everything from your basic fillings to crowns to cosmetic work. We do a lot of whitening. We do a lot of veneers and bridges. We prepare patients for implants. We do extractions in our practice. You do
wisdom teeth
We
as
do
well?
wisdom teeth, yeah. We do wisdom teeth.
You do a lot of
patients.
extractions.
I do a lot of extractions.
That's your role in the practice?
That's pretty much my role. I'm the sedation guy, the surgery guy. And then my wife, Dr. Michelle, she's more the...
I've had her on the show, by the way.
She's great. She's more of the cosmetic person in the practice. We both kind of fill our own little area of dentistry that we both like to concentrate on. It works really well.
So IV sedation, I guess less than probably 10% of all general dentists in the world do IV sedation.
There's not very many. I mean,
why do you do it?
I do it because I want patients to get the treatment that they need. I don't want fear of the dentist to be a barrier to them getting the treatment that they need. I mean, we're talking about their health. We're talking about their smile. I mean, it's so important.
Now, you do a lot of charity work. I guess you and your wife both did about a year and a half working for a nonprofit.
We did. We worked for a nonprofit organization, a community health center in Missouri, where patients that couldn't afford to get treatment anywhere else came to see us for their treatment. And naturally, because of that, we did a lot of extractions as patients that maybe hadn't been to the dentist in a very long time, and so their teeth were in very bad shape. So I pulled thousands of teeth over the 4 years that we worked there.
Without sedation?
No sedation, or very minimal sedation, sometimes nitrous, laughing gas. And sometimes it was just gut-wrenching. It's you know, yes, we're numbing the patient. They don't feel anything painful necessarily during the procedure, but it's scary. It's hard for them to go through, and it really made me realize that if I could just have a way to make that more comfortable for patients, that it would be so much better for them. Okay,
and so you need special licensing to get IV sedation.
You do. You have to go through certain education, training, certification. You have to apply for the permits and have all that in place. Not anybody can do it.
Okay, and so let's talk about the categories of patients that you see that come in for IV sedation.
Yeah, we see there's a few different types of patients that need IV sedation. The first category is probably the patients who are so scared of the dentist. They haven't been to the dentist in years. They've been putting it off because they're just so scared.
Like a phobia.
A phobia.
Is that common?
It's so common, Randy. You don't even know. The University of Washington did a study in the late 90s. Up to 16% they found of Americans do not seek dental treatment simply because of their fear for the dentist, their fear of the dentist.
Okay.
That's over 50 million Americans that are walking around out there refusing to go to the dentist, not because they don't have insurance. These people have insurance, they have money, they're just too scared. And on top of that, over 50% of people responded that going to the dentist produces some level of anxiety.
Okay, so with the highly anxious patient that are afraid, with this IV sedation, and by the way, let me ask you this though, do you still hear it? Hey doc, I can't stand going to the dentist. Or no offense, I don't like the dentist.
I do, every day.
And like how do they say it?
You know, I hate being here. That's the number one thing. I don't want to be here. Or you know, I've always been afraid of the dentist. And I think my job as a dentist and in relating to my patients is to make them feel more comfortable. So we need to figure out why. You know, what is it that they're afraid of? Are they afraid of...
Do you ask them?
Yeah, totally.
What do they say?
I'm afraid of the drill. I'm afraid of the needle. I'm afraid of being vulnerable. I'm embarrassed of my teeth. A lot of patients, especially that haven't been for a long time, you know, they're just simply embarrassed of their teeth and embarrassed to show somebody their teeth because maybe they've been walking around not showing anybody their teeth. I had a lady crying in the parking lot, refusing to come in. We got her into the waiting room. She's crying in the waiting room. We got her back. I didn't even take her back to the chairs.
Did you get involved? You say we got, I mean, did you kind of have to walk to the waiting room
I walked to the waiting room, and we took her back to the consultation room, and we just had a chat. The first visit was nothing but a chat. I said, let's just get to know you a little bit. Let's find out why you're so afraid. Now, after going through IV sedation, multiple appointments with different types of treatment, she comes to the office. She's no longer afraid to come in. She comes in smiling, happy, and we've helped her get over that fear. And she doesn't even hardly ever need even nitrous anymore for her treatment.
Now let's talk about the different types of sedation, by the way, because IV sedation, I mean, you told me on the phone, it's safer to do IV sedation than to do nothing at all.
Statistically speaking, IV sedation is much safer than doing nothing at all, and much safer than oral sedation. The literature shows you're much less likely to have a negative complication in a dental office if you are
because I guess blood pressure is controlled.
Keeps blood pressure well controlled, keeps the heart rate steady. You know, anytime you're in the dentist chair, you're putting stress on a body. Anytime you're going through surgery, you're putting stress on the body, and that stress causes your heart rate to go up. It causes your blood pressure to go up, and all those things can be controlled with medication that we give during IV sedation.
This is not like anesthesia at a surgery center.
No, not at all. That is an option that some patients have to have, but in our office we don't do that, and that's totally different. And that's one of the big misconceptions about IV sedation.
So it's not like a tube down your throat.
No,
I mean, it's just
no
IV
tube.
sedation.
It's an IV direct access, but you're still able to maintain your airway. You're breathing on your own. You're able to respond, but you don't feel anything and you don't remember anything.
How is it safer than the pill, though? Because the pill seems easy.
The pill's easy, but it's a one-size-fits-all approach. The pill, you have to swallow it, so you have to wait. You have to wait on the digestive system to absorb that medication. And maybe that one pill might be great for one patient, but for another patient it might not be enough. And so what do you do with that patient? That patient is now still feeling it, still awake, still remembering things.
Is it true that people, I guess, that have had multiple surgeries throughout their life, the older patient, you can't, the pill may not even work for them?
No. In a lot of cases, they build up a resistance to that, and so the pill might not work for them. It might not be enough. And then what are your options? Your options are then to give them another pill and then wait. Or you might have someone maybe smaller, younger, petite, young lady, and that pill is too much for them, and then you're running the risk of overdosing them.
So you can't pull them out of it though instantly.
It's not instantly. No, you have to give them an injection.
IV sedation you can?
Instantly. And that's one of the safest things about the IV sedation. Not only are we measuring that medication and customizing it for each individual patient, you know, we give a little bit at a time until you're comfortable, but if we happen to give too much, you happen to be a little over sedated, we can bring you out of it like that.
But you can talk to them. I mean, they can respond a little bit.
Yeah, I mean, there's some funny stories that the patients will tell us stories during their procedure, and they don't ever remember it, but they'll tell us, you know, different stories about their life, or they'll repeat things that they, you know, probably don't want repeated outside of the office.
So the highly anxious patients that are watching this, that they think their mouth's a disaster. You said your patients haven't seen the dentist sometimes in 20 years. 20
years. I mean, they're so afraid to come that once they get in, we've got a lot of work to do in a lot of cases. And that's the danger with putting it off. We do a lot of surgery in our office, so we also see patients that need their teeth extracted, or maybe they're getting ready for dentures, or maybe they need their wisdom teeth out, which everybody...
Because you do a lot of extractions.
Lots of extractions, yeah.
Okay.
So we see those patients as well.
So tell me about the wisdom teeth patients. So they are the 18-year-olds, 70-year-olds, are they doing the IV sedation as well?
Yes, yeah. 16, 15, 17, depending on when they're ready.
And not all dentists are doing this. Do you think parents probably may not know that. That means, in your opinion, if people are given two options?
In my opinion, it's much better to get it done with IV sedation, the wisdom teeth. And if you... You know, but a lot of dentists don't do wisdom teeth either, you know, so it's not just the sedation, but it's the ability to do the wisdom teeth as well. A lot of these wisdom teeth that are done, these teenagers are 16, 17 years old, and they're going into the office and they're getting their wisdom teeth taken out with no sedation. They're getting them taken out just with local anesthetic, or maybe even with nitrous. And that can be very traumatic. And these patients, these kids, now have that bad dental experience that they're living with for the rest of their life. So, you know, that's never anything that we want. We want patients to be comfortable, get it done, have a good experience, so that they're not afraid of the dentist for the rest of their life, so they don't have that memory, that negative connotation that goes along along with the dentist, oh, I had my wisdom teeth out, it was a nightmare, you know, that we hear that so many times. And that's
they didn't go to Dr. Hedgecock.
They didn't come see me, because that's not what my patients say.
But I was thinking, you know, the demographic of the kind of person, or psychographic of the kind of person that's afraid of the dentist, are probably afraid of sedation too.
They are, and sometimes we have to give medication before we even give, you know, sometimes we'll give us an oral sedative to help out, or we'll use nitrous oxide to help out with even giving the IV started. I've done that on many occasions. I've had a couple patients that are even afraid, they're so afraid of the dentist that it's hard to even get the IV started on them. And for those patients, we've had, for example, last week we had a patient, we gave him a pill to take the night before. So we gave him an anxiety medication to take the night before. The night before even, yeah, because these patients, I mean, if they're that afraid, they might not even be able to sleep. They're going to be up all night worried about the next day. Oh yeah, these patients are phobic. So a medication the night before, they come into the office, they've taken the medication again that morning. You know, they're feeling pretty comfortable.
Somebody gives them a ride in.
Somebody gives them a ride to the office. We give them some laughing gas. We put them on some nitrous oxide, so they're breathing that in. They're feeling good. They're breathing that happy gas, we tell them. We've got our assistant. They're holding their hand. They're distracting them. They're talking to them. They're walking them through it. We give them the IV. We get started, and then they say, Doc, when are you going to start my IV? And I'm like, well, hey, we already did it. We're already going. These patients, you know, they don't even know. And
oh, really?
And they're like, oh, that was no big deal.
When it's all done, do they ever say, I mean, are they ever...
They're appreciative.
But are they ever surprised that it's over?
Oh, all of them. What? I mean, and here's the great thing about that medication.
So it's amnesia. It's kind of like
it makes a 4-hour appointment sometimes. Some of these bigger cases, these large full mouth cases that we do, take 4 or 5 hours in the chair. They wake up and it feels like 10 minutes. So they're like, what, we're done? And you know, of course, I'm sweating over there.
You're exhausted.
I'm tired. We've been working on my staff. We've been working
like 5
on
minutes to them.
To them, it's 5-10 minutes. And they're like, oh, I can't believe we're doing it.
You know, I try not to, you know, give my own personal stories on the show, but I recently had some dental work done and had the nitrous. Okay, to me, it was like a day at the spa. I mean, it was really relaxing. I'm watching a TV, and I was thinking, I don't think the dentists tell people enough how relaxing it can be. So from that experience, I interviewed another dentist. He goes, oh, well, we don't, it was on the phone. He goes, well, we don't use nitrous. I don't think it's necessary. I think, no. I almost felt like that might be insensitive of the what are your thoughts on that?
I'm a big fan of nitrous. We have nitrous in our office for anybody that needs it, and we
because it is relaxing.
It is. It's totally relaxing. We have patients that come in just for their cleanings, and we give them nitrous.
That's like the laughing.
That's the laughing gas. Yeah, they're breathing it in, and that's great. That's easy. It's quick. It's reversible. No hangover. You know, you don't have to have someone drive you to the office. So that's that's the lightest, easiest form of sedation that we do, and it works so well that I don't know why some dentists don't use it.
Now, you know, I mean, our show airs all over the country, and I interview medical doctors and dentists, and I've had dentists tell me off camera, Randy, I don't want these anxious, phobic patients. They don't like them. Why do you like dealing with that kind of a patient?
Because it's life-changing for them, and it's, you know...
Is it rewarding for you?
It is. It's very rewarding to be able to have these patients and work them through and get them over that fear, and to have them, you know, to where they're crying in the parking lot and they won't even come in the office, to now they're coming in, they're bringing their friends and family, they're sending people, they're telling everybody they know how easy it is to go to the dentist if you go to the right dentist, because of their experience.
So don't let your fear keep you from having the smile you've always wanted. Now, you're a dentist. Of course, you probably think the smile's pretty important. And I asked your wife, who works with you in the office, how important it was. How important do you think the smile is?
The smile is incredibly important. You speak of my wife, that's the first thing I noticed about her smile. That's the first thing.
You met in dental school?
We met in dental school.
Love at first sight?
Love at first sight.
It was really her smile?
It was really her smile.
Okay.
I mean, you look at any survey done, any magazine, any survey, there's two things, the smile and their eyes that people are attracted to. So if you're single, you're looking for a date, you need to open your eyes and you need to smile. Otherwise, you're not going to get a date. That's what I take from that. But it changes people's lives. It gives them, you know, courage, to confidence to go and apply for a job they want. It gives them, you know, the ability to go up to a stranger and talk to them. It gives them, you know, people just are so much more comfortable. You having a bad day? You know, sometimes I wake up and I'm having a bad day. I'm kind of grumpy. I go to Starbucks and I get my coffee, and the barista looks at me and she gives me a big smile. How you doing today, Dr. Hedgecock? And instantly I cannot be in a bad mood anymore. It's that kind of thing, that kind of power.
But you have
that
a nice
has.
smile. Do you have a tough time smiling all the time and talking?
You know, I do. I'm not super comfortable, you know, smiling in public or talking in public, but
your wife made you do this.
She
made
did.
you come on the show.
She did. She wants to tell our story. She wants people to know that there's an easier way to get your dentistry done and to have that smile that you want to
So
have.
IV sedation allows people that are afraid to get this done. They have amnesia. It's easy. Let's talk about the busy person, because you say there's a lot of people that are just the type A or business people, and they just don't, they say they don't have the time. So,
yeah, we've got, I mean, everybody's busy. I mean, we've got kids in school, we've got, you know, work, we've got projects, we've got everything out there. And these people come into the office, and they may not be afraid of coming to the office. They may be okay with that, but they've got a couple fillings that they need, and one's here on this side and one's on the other side, and they've got a crown up here, and you know, normally that would take a few different appointments to do, and they say
like
hey,
3 or 4 appointments.
3 or 4 appointments, and then you know, they're taking off time from work and school and all that kind of stuff, and they say, hey doc, is there a way we can do this all at once? And I tell them, I said, yeah, we can do it all at once, and we can even do it all at once if we do sedation. That makes it easier to do it all at once.
So 4 or 5 hours in the chair.
Exactly.
So you could do what may take 4 or 5 appointments.
Exactly.
That's very interesting. Because
And
bosses don't like that, by the way. You know, you hear one dental appointment, then you hear, geez, 3 times at the dentist? What's happening here?
well, multiple cavities, you know.
Okay,
So if
okay.
they've got multiple problems and they want to get it all done quickly, in one day, they can take one day off from work. They can come in. Oftentimes, Dr. Michelle and I will tag team these cases. You know, they'll come in.
And if they're just tuning in, Dr. Michelle is his wife. It's Dr. Hedgecock and Dr. Hedgecock. So
Yes.
Okay, go ahead, go ahead.
So we can work together and collaborate together to help these patients out. You know, and I'll provide the sedation. She'll do some of their cosmetic work, and then I'll go in and do. I mean, we even do their wisdom teeth the same time, you know, after we do their crowns or their fillings that they need in many cases. We've got one patient, she came in, she's 20 years old, she's in college, she's got 2 jobs. She's got a weekend job and then a daytime job. And unfortunately, going away to college, she started drinking lots of soda. All of a sudden, she came back. It was a year after she got into college. She had a cavity on almost every single tooth in her mouth.
Wow.
So we started her off. We needed to start this. Normally what we would do in that case is we'd do it quadrant by quadrant. So we'd break it up into 4, 5, maybe 6 appointments, depending on how many teeth we can do in each appointment. And each one of those appointments would normally be about an hour and a half long. And
Is that right?
yeah, so
like 5 appointments?
5 appointments for the full mouth. I mean, because
Okay.
literally we had to work on every single tooth in her mouth. And she said, I just don't have time for that. She said, 1, I'm a little nervous about it. 2, I've got school, I've got homework, I've got tests to study for. There's got to be a better way. And so we said, hey, let's do this with IV sedation. You're going to be here all day. You need a ride. You need somebody that can bring you and take you home, but you're going to be here all day. So she came 7:30 in the morning. She left at about 2 o'clock that afternoon. Dr. Michelle and I worked together all morning, back and forth, prepping teeth, fixing them, restoring them, a couple of fillings, a couple of crowns, and the whole mouth was done, and she didn't have to come back.
In your industry, is that a proud moment for you, like where you go, wow, this was a good day?
It is. It's a good day.
This is how you get your kicks, right?
Well, yeah.
I mean, helping people, really.
Well, helping people. Not only, you
'Cause
know.
I don't think of being a dentist as fun, but it's fun for you.
And she was nothing glamorous, and it was, but we were able to fix all of the decay that it was in her mouth, rid her of the disease that was in her mouth, and work with her schedule so that she didn't have to miss so much time away from work and school.
So is it possible there's a lot of these people are out there, like this gal, that maybe because it's going to take 5 appointments, just say forget it, and they put it off and put it off, and then they end up losing teeth?
We do. It can be so detrimental. If you put off the treatment that you need, you're going to end up, these problems don't solve themselves. They grow over time. And we get a lot of patients, they come in, maybe they'll do 1 appointment, or maybe they'll do 2, and then they kind of get tired of it. And they say, you know, I just don't think I have time or want to go through 3 more of these appointments. And those are the perfect situations where this really can help them out.
So when they come in, how do you bring up the IV sedation? Or do people come to you by reputation for IV sedation?
A little bit of both. More lately, we've had a lot of people that come to the office strictly because they're looking for someone that does sedation. And you know, nowadays, and especially Austin, it's a high-tech place. Everybody does their research on the internet, so they're looking for a sedation dentist. We get a lot of people that way. The other patients come in and we just sense it. You know, we're talking to them during the interview, during the exam. You know, do you have any fears of the dentist? Do you have any concerns about your treatment? Or if they need some more extensive treatment, we just present it to them as an option. And this is
you say, I don't make money. I don't want to make money from sedation.
I don't.
Elaborate on that. What you mean by that?
You know, a lot of times in a lot of offices, you'll see that they charge by the minute. You know, the anesthesiologist starts that clock as soon as the patient starts.
You said you worked under those conditions. Or you saw that?
I saw that. Yeah, I have many patients come in and they say, geez, I paid more for anesthesia than I did, more for the sedation than I did for my teeth, you know? And that's not the point to me. The point for me is...
they charge by the minute.
They charge by the 15-minute increments, yeah. And it's crazy to see that someone will spend, you know, $2,000 in sedation for
really
$2,000 worth of treatment. So they're spending $4,000 for the treatment that only costs $2,000.
Really? So
yeah.
some sedation could cost...
Some sedations do.
Yours is in the $300 range.
It's a flat fee, $385, regardless of what we do. I don't want the cost of sedation to be a barrier to that patient getting the treatment they need. That's the reason it's there. So patients can get their treatment easier and safer and more comfortably, not to make money off of the sedation.
Who likes sedation the most? I mean, is it the older patient that likes it the most, that can appreciate... like, why didn't I do this years ago?
In a lot of cases it is. I had a patient just a few weeks ago that said, I don't know what, he put off getting his wisdom teeth taken for years and years and years. Like, he was 48 years old. He was told at age 20 he needed to have his wisdom teeth removed. He put it off, put it off, put it off. Finally started getting this infection back there around the wisdom teeth that was eating away at the bone. He was nervous. He was scared about it. And, you know, what is he remembering? He's remembering what dentistry was like 20 years ago. And so for him, we finished and he said, that was the easiest thing I've ever done. You know, and we pulled his teeth. We did surgery, you know.
Okay, okay. Now, not all dentists do extractions as well.
No.
Usually they have to go to the specialist.
Sometimes.
Are you less expensive, by the way, than some of these specialists?
I think much less.
You think, or you know you're much less?
I know I'm much less.
You're much less. So let's mention that. What kind of training do you have? I guess you have to have specialized training in... I guess an endodontist would normally do wisdom teeth.
No, endodontist does root canals. Okay. An oral surgeon is someone who specializes and do a lot of implants and wisdom teeth.
I see. Okay.
Okay. There's not, you know, as a general dentist, you learn in dental school everything that you want to learn or need to learn to be able to do those services. It's just the matter of how much experience you get doing it. When I was in dental school, I participated in a wide variety of externships. Where I was working in surgical clinics and hospital settings and different local community clinics, and I had the chance to get a lot of experience doing wisdom teeth. I had great mentors that coached me in teaching me how to do wisdom teeth, so that when I graduated...
So you've been doing wisdom teeth for a while?
Yeah, thousands of them.
Really?
Thousands, yes.
Interesting,
yeah.
Interesting.
And like I said, up until last year, most of that was without sedation.
You still volunteer, by the way?
I do.
For helping people that don't have the money?
Yeah, we do. We do, you know, a certain amount in our office, but there's a nonprofit downtown. I spend every Friday downtown helping out in those clinics. There's a few nonprofit clinics in town that we help out at, and occasionally we'll do mission trips and those types of things down to Mexico and help people out that way.
And these extractions, by the way, okay, so wisdom teeth, this is the part I don't get about wisdom teeth. I mean, if you're in your 30s, 40s, 50s, whatever, and you've never had your wisdom teeth out, why would you want to do it? If everything seems to be fine.
Everything might seem to be fine now, but the problem is what can happen in the future. If your teeth aren't in the right alignment, these wisdom teeth can cause infection, they can cause crowding, they can cause pocketing back there. We've seen patients that have never had their wisdom teeth out, and all of a sudden one day they show up swelling on the side of their face, just huge, massive infection, because all of a sudden enough bacteria got caught around them to cause this infection.
So they're not necessary. They're way in the back. I don't think I've ever even seen the look. I had mine out at 17 years old or something like that.
No. We've got enough teeth everywhere else that they're not necessary.
And it's not that painful these days? I mean, is it easy? I don't remember it being painful for me.
It's not painful. I mean, you're going to have, just like any surgery, there's going to be a couple days of soreness and tenderness back there. But the human body is an amazing healer. And within a week, you know, patients are back on their feet, no problems at all.
But IV sedation, get IV sedated. And not all sedation dentists, because, you know, I did some Googling, and not all IV sedation dentists are the same.
a lot of dentists will advertise that they are sedation dentists, but that could mean that they're just providing laughing gas. It could mean that they just do, or they just do oral sedation. Those are types of sedation. So you need to make sure you're asking if they do IV sedation. Do they do oral sedation? Do they do wisdom teeth with their sedations? Maybe some sedation dentists do IV sedation, but they don't extract teeth. They still send their extractions to the oral surgeon. So if you're needing your teeth extracted or needing your wisdom teeth out, they wouldn't be able to help you even though they did IV sedation.
Okay, now at the top of the show, we're just about out of time. You know, we said don't let the fear of the dentist keep you from having the smile you've always wanted. Do you have stories of people that never smiled and then because of IV sedation, as you quote, you know, it lowers the barrier? Do you have people that now all of a sudden are smiling and their lives have changed because of it?
I've got so many stories of patients just like that, Randy. I have a patient a couple years ago, and this was probably my most miraculous story. I just love this guy, Steve. He's a middle-aged man. He had lost his job. He was down in the dumps. He was really just depressed, and he had 2 of his front teeth that broke off. And he came in, and he hadn't seen a dentist in years because he was very, very afraid. And we started talking, and we went through his fears, and we were able to restore his mouth using IV sedation, making him comfortable, replacing the missing teeth, fixing his decay. And, you know, but there was other things too. He was a smoker. And all of a sudden, he decided, you know, he got his teeth fixed. He's going to stop smoking. So he stopped smoking, and we helped coach him through that. And he decided he was going to start working out more. So he started walking every morning. And a year and a half later, he's got a new job. He's healthy. He's not smoking still. He's off of all of his depression medication that he was on. And he credits all of that to going back and fixing his teeth.
Is that right? Does he tell you that?
He tells me that. And this was not your typical, this wasn't any fancy smile makeover. This was a very simple, you know, this was partial dentures. But it changed his life to restore those teeth. It gave him the confidence to get that new job, to be more comfortable, to smile. It changed his life.
Who would you like to see more of? I mean, is there a specific kind of patient you'd like to see more of in your office? Of the people that are walking around doing nothing?
I want to see patients that are looking for a better dental experience. I want to see the patients that are unhappy, you know, with their smile. They're unhappy, you know, or they might not know that they're unhealthy because they haven't been in a while. I want to help coach them through that. I want to help get them through those fears that they have and show them that dentistry today can be so much easier than what's in their mind, that you don't have to hate the dentist. You don't have to hate me.
And you have free consultations. Is that right? I mean, somebody watching this, they can call, meet with you, get an evaluation.
They can come in, we give an evaluation. They, you know, free consultation, second opinions. Sometimes we have patients from other dentists that, you know, maybe they were told they needed some treatment, but they just want that second opinion, or maybe they want sedation to do it. We're happy to have them all.
Now, in your office, I'll put you on the spot here. Okay, so you and your wife together, both Dr. Hedgecock, but they go by Dr. Brandon and Dr. Michelle. I mean, is it equal? I mean, who wants to see who the most?
It's pretty equal. I think patients see both of us. You know, she's got a little bit of a different niche, so the patients that come in that are, you know, I want veneers, or I want
like
to whiten the cosmetic stuff, you know, we'll send them over to Dr. Michelle. And then, you know, the patients that come in and are more of the scaredy cats, or they need their wisdom teeth out, or they have a broken tooth that needs to be extracted, and, you know, they'll see me. It's pretty equal.
She says that you like to think that you're the sedation king.
In our office, I like to think that, yeah.
Well, thank you for coming on the show. Great information. So if somebody wants a consult, call your office. You'll sit with them, free consultation.
Absolutely.
Don't let your fear of the dentist keep you from having the smile you've always
wanted.
All right. Thanks again for coming on the show.
Thank you.
You've been watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. If you would like to see this interview again online, visit our website at wellnesshour.com. You could put in Dr. Hedgecock. You could put in Sedation Dentistry. You'll find him there. And if you're on Twitter and you want to say something nice about Dr. Hedgecock, you could just put #WellnessHour. For now, I wish you good health.